Hello and welcome viewers to another segment of LiveExpertInterviews.tv. My name is Steve Young and thank you so much for joining us today. Today we're talking about a very important topic, and that topic is how to find a good neurologist. Now fortunately, joining us from Stuart, Florida is Dr. Randy Hansbrough. Doc, thanks so much for joining us today.
Steve, thank you very much, and I appreciate you having me on the show today.
Absolutely. So Doc, really before we even get started, why don't we take just a minute and talk about what a neurologist is and does, and that would help the viewers, I think.
Absolutely, I'd love to do that. Well, a general neurologist, such as a medical neurologist, I think most people are familiar with that type of a doctor. He's the kind of neurologist that will, or she, that will prescribe medications for specific neurological conditions, such as insomnia or depression or conditions like that. A functional neurologist, on the other hand, which is what I do, is not a medical neurologist. I do not prescribe any medication, but instead we look for the underlying causes of the neurological disorder, and we do this with functional brain evaluation and lab testing. That way we can determine what kind of non-drug therapy we could administer safely and effectively without side effects.
I love it, Doc. Thanks for giving us a little bit of background and education on that. That makes good sense. Now, let me ask you, with all your years of experience, what advice would you give to somebody looking for a good neurologist? Maybe say like the top 3 things.
Well, I would say that you should first look at the training of the individual and to what degree that they have become certified in their area of specialization. And I say that because it's important if you have someone who's going to be looking out for the optimal health of your brain and your nervous system, you want to be sure that they're well trained. I went through a training program to achieve that certification under the auspices of the National Commission for Certifying Agencies.
I love it, Doc. What else? You mentioned something about checking for maybe reputation and reviews, that kind of thing.
Well, I believe it's a good idea if the individual who's looking for a neurologist knows as much as possible about the doctor that they're about to go see. So they may want to look into the results that that doctor has been able to achieve, perhaps some first-hand testimonials of the patients that he or she has treated, perhaps an actual verification, once again, of the studies and the education that that doctor has gone through after an actual license was obtained.
Got it. That makes good sense, Doc. Let me ask you, Doc, if somebody was looking for a neurologist and they came to your office, what type of an experience could they expect?
Well, first of all, they would be greeted very warmly by my trained professional staff, and after all of the usual formalities are taken care of, such as the history and the form, the paperwork that's filled out, that person would then undergo an evaluation with me, which would consist of an assessment of the function of the cerebellum of the brain, that's the balance and coordination mechanism of the brain, an assessment of the upper hemispheres of the brain to see if there's any imbalance in regards to left and right function, and also an assessment of the cranial nerves, such as the movement of the eyes, the response by the eyes to light, the sense of sound on each side of the head, the sense of smell on either side of the head, and sensations like this that would give us an understanding, a much better understanding of the efficiency or the lack of function of the brain.
Sounds like a pretty thorough exam to me, Doc.
It's very thorough. And some other aspects of that evaluation would involve what we call a neurofeedback brain map. And that has been a technology in development for approximately 40 years all across the United States at universities like UCLA, University of Utah, University of Tennessee, and several others. So there's a lot of science behind neurofeedback.
Wow, very impressive. Let me ask you this, Doc. You know, I know with your experience, how is your practice maybe different from some of the other functional neurologists in the local marketplace?
Well, there aren't many functional neurologists around the state of Florida. In the entire United States, there are approximately 500 of us. And that's because we have to go through a lot of additional training, and it's a lot of hard work to achieve that certification. So I really don't have any competition in my immediate area. Other areas of Florida, we practice very similarly, to be honest with you, because we have to go through the same training. So there's a certain standard that we have to adhere to in order to deliver the quality of care necessary, and that's all part of our National Commission certification. But I would say that, to answer your question more accurately, if I understand you clearly, the distinction between a functional neurologist and a medical neurologist is we're using non-pharmaceutical therapies. The distinction between a standard chiropractor and a chiropractic functional neurologist, which is what I do, is that we just have more certification with respect to the function of the brain and how to manage it, again, without drugs.
I love it. Now, Doc, you also made reference earlier when we talked about the results. The results that you're able to produce for your patients are just phenomenal.
We do get phenomenal results. We treat a lot of conditions like chronic vertigo, dizziness, insomnia, depression, attention deficit disorder, attention deficit hyperactivity disorder, both children and adults, and a wide range of other neurological conditions, which is very gratifying to see the results that can be had by gentle and body-friendly natural therapies designed to very gently coax the brain into a more efficient state of being.
Wow, I like that a lot. Now, Doc, I know you said you do some very special things for new patients. What exactly is it you do for new patients?
Well, functional neurology, as well as functional medicine, is not widely known because there aren't many of us out there. So we offer to the community an easy way for them to come in and become familiar with what we do. That way we can spend some one-on-one time and really get to the core issues of that individual's personal problems with respect to brain function and other body functions. So we offer 2 visits where they can come in and get to know us better, where on the first visit we're going to conduct a very thorough evaluation and examination, as I mentioned earlier. I might order an additional test because I ask them to bring in all their lab tests when they present on the first visit, and based on those lab tests, blood, urine tests primarily, I may make an additional recommendation. If so, they will go and get that additional test, and then when they return on the second visit, we will review all of their history again, their labs, and the additional tests that they had done. At that point, I can make a logical and customized recommendation for that patient that has a high degree of probability of success.
I like it, Doc. Wow, that's a lot of stuff, and that's 2 visits.
That's over a period of 2 visits. So it's approximately an hour and a half to 2 hours total. We will be spending a lot of time with that patient and getting to know their condition well and what we can do to help them.
And what's the cost of those 2 visits, Doc?
Normally that cost would be around $387, but we offer that for $87 for those who respond to this particular interview that we're conducting right now.
Wow, I like that a lot, Doc. Okay, so viewers, there you have it. If you're looking for a neurologist or a functional neurologist, all right, make sure you take the Doc's advice when you go online. All right, look for their education, their experience. Take a look at their reputation, the reviews that they have. And if you're anywhere near Stuart, Florida, make sure you look up Dr. Randy Hansbrough for your neurologist needs, all right, or any other needs. Now, Doc, what's the best way for them to get a hold of you?
Our local phone number is 772-287-7701. Very often that line is busy, so they can then call 287-7707, or they can reach us online at hcfn.org.
I like it, Doc. I want to thank you so much for joining us today.
Thank you very much, Steve, for having me.
Absolutely. Viewers, if you're anywhere near Stuart, Florida, make sure you look up Dr. Randy Hansbrough. Thanks, Doc. Viewers, we'll see you on the next segment of LiveExpertInterviews.tv.